So, did you know that during menopause, women can lose up to 30% of their collagen in the first 5 years? And it's one of the reasons skin can suddenly feel thinner, drier, and even less firm. So, today we're talking about what's really happening in menopausal skin and how we can support it. So, hi everybody, I'm Renee Altacredi, founder of SQT Australia. And today I'm joined by one of our SQT clinics. We're going to talk about something that so many women experience, but we don't often talk about it enough. And it's how menopause affects the skin, and hormonal changes can bring new challenges like dryness, loss of elasticity, pigmentation, slower skin renewal. And today we're going to explore exactly what's happening in the skin and how treatments that support regeneration can actually help. So we're joined by Peggy, one of our SQT certified clinics down in Victoria. Thank you, Peggy. Welcome.
Thank you. Hi, Renee. How are you today?
I'm well. Thank you for asking. Excited to have you on.
Thank you. Thank you.
So, Peggy, what clinics are seeing, and from what you can see in clinic, what are some of the most common skin concerns women experience as they move into that perimenopause or menopause phase?
Okay, so with the drop of estrogen, as they're moving into that phase, we're looking at thinning of the skin. We're looking at skins that are a lot more sensitive. We're also looking at broken capillaries. We're looking at an impaired barrier, loss of microbiome on the skin. So there are a lot of sensitivities going on because as estrogen declines, so does a lot of other things as well. So everything's in an inflammatory state.
Yeah, I've seen that a lot in my clinic as well. And sometimes you get a little bit stuck with how to treat those types of skins.
Mm-hmm.
And sometimes people think we need to use more aggressive measures, and it's not always the case. I love my SQT anti-aging. I'm
Mm-hmm.
perimenopausal myself, so I find my barrier, can play up a little bit if I've got too many harsh things going on. So
Mm-hmm.
yeah, definitely found the anti-aging set amazing because it's
Mm-hmm.
got those peptides in it. It's got the delivery using the 1.5 million spicules.
Yeah.
And the skin changes that we go through are absolutely profound, and it's a never-ending list. And many women feel like their skin just suddenly changes, and it
Mm.
almost
Yes.
happens overnight. Can you explain what's actually happening in the skin during menopause that leads to things like thinning of the skin and dryness and that loss of firmness?
Yes, that's right. So what happens is with the drop of estrogen, and as you said earlier, 50% or 30% of the collagen declines in that first 5 years. So as you're reaching into the menopausal state of your hormonal journey. Like myself, I'm 64 years old, so I can clearly speak how my skin's reacted. The skin thins, it thins up to 1.2%, and then the skin's not behaving how it used to in the past. So, of course, the products that we're using or we were used to using, we can't use anymore because the skin's so much more reactive. So I can speak about my skin and even with other people's skin around my age group. What I'm finding is that what we need to be doing is building up that barrier, building up that ceramide 1 so that the skin is a lot more tolerable. I mean, we're not secreting the same oils and lipids like we used to due to the estrogen
Mm.
declining. So women really need to be picking up the water, picking up the essential fatty acids so that
Yeah.
when that skin is going through the stages through granulosum and it's secreting those oils, they've got to be intact so that we're not suffering with the usual problems of estrogen decline.
Yeah.
And that's what I'm finding. I think, clinics out there should be looking at products that are going to be working with the skin, not against it.
Yeah, absolutely. Perfectly said. And when you're working with that menopausal skin, what do you think's most important when you actually choose a treatment that truly supports the skin rather than overworking it like we see in today's industry.
Well, I think we're slowly shifting away from that anti-aging thinking, the hard modalities, the fillers, all this type of thing. We're moving away. We're going more into a holistic approach and
Yeah.
working with the skin, not against it. So what I'm finding is that the key thing is that, when we're getting these clients in and we're looking at the skin and we're doing a thorough skin analysis, and this is something I wanted to get into as well. It's important, like if we're looking at a menopausal skin, I think having a questionnaire that's guided and asking those sorts of questions is super important, because then we can really look at how we're going to be listening what the issues are and then really treating that skin. So I think skincare is first and foremost. Make sure
Mm.
that barrier is right, and then we can get into the modalities or treatments that we're going to do, like for
Yeah.
instance SQT Bio Microneedling.
Yeah.
But I think it's a really, with my clients, I find it's a safe little haven to go to. I love, and I've got the packages here. If anyone's watching, I've got them.
You
I
got your
actually
order okay?
Yeah, I do. I actually
Yeah.
love this one here. I find, if you're
Yeah.
not too sure, always when we're treating skin, especially if they've got a barrier problem or, I think hormonal skin, treated as a sensitive skin. Go in with
Yes.
something that's sensitive. We've got
Yeah.
less spicules in there, not too much rubbing. I mean, when I've been doing clients and I'm working on the skin and I can see that skin going, inflaming only because of growth factors, but I can see that client might be a little bit uncomfortable. I stop there and then I start, wrapping up that treatment, putting on the mask, and then we're still getting the results. The spicules have gone in.
Yeah,
And then that's
absolutely.
we're still getting
Yeah.
the results, but we don't want to, like you said earlier, overwork the
Overstimulate.
skin.
Yeah,
So,
because
sorry.
yep. No,
Yeah,
I
so
was going to say SQT focuses on supporting the skin's natural renewal process,
mm,
whereas some treatments don't. They're trying to force it into a certain pathway that it's just not cut out for.
mm.
So, how can treatments that stimulate regeneration help improve the overall health and appearance of menopause?
Absolutely. Yep. And so what it's going to do, it's thickening, as you know, the spinosum layer. And because
Mm.
the layers of the skin or spinosum layer is going to be thinning out due to the drop of estrogen, we want to get that skin function as normal as we possibly can. So in order to do that, when we're sending those beautiful spicules into the basal layer, I'm creating brand new skin or a brand new keratinocytes through the stimulation, we are then getting that nice, thick, beautiful spinosum layer. So,
Mm.
as I stress with the girls out there, drink your water, 2 litres of water a day. Or work it out.
Yeah.
It's meant to be 35 mils per kilo. So work out your water intake,
Yeah.
and a good quality essential fatty acid. So those actual keratinocytes are beautiful, juice, plump. They're going to be beautiful. So when we do the treatment, we get that nice thickening of the spinosum layer.
I've
Um,
always likened it, Peggy, and I've used this metaphor for probably a decade now. A grape versus a sultana. The
that's
grape
right.
is nice and plump. The sultana is really dehydrated and really leathery looking. And you see it so often in today's
That's it.
world for women, and they're like, I'm so dry, I'm so dry.
Mm,
My mum's a classic example. She's, probably bit on the tail end of her menopause.
yeah.
I was unfortunate. I started a little bit earlier in my late 30s.
Yeah.
But I'm very lucky. I've got oily prone skin.
Yeah.
So I never have to use moisturizers. I do regular treatments. I make sure my skin's supported with, non-harsh modalities.
Yeah.
And that's why SQT for me, it's just like my ritual. It's become part of just like you would cleanse your face every day, SQT's
Yeah.
become my ritual. But for
Yeah.
women who feel frustrated or unsure about how to care for their skin during menopause,
Mm.
what advice would you give to them who are looking for treatments or professional support?
Okay, so looking for treatments and professional support. I'm going to hit the treatment side of it first. I feel that when women are coming into the clinic and are looking at improving their skin due to all of the factors we've just spoke about, it's good to do like a little package, I find is very good. Once we've got that skin into where we want it to be with products. And I find with SQT fits in beautifully, where you could even use even 3 of the packages. You could do the rejuvenation set and you could do the nourishing set. But if we've got a little bit of pigmentation going on, we can even introduce the brightening set. So we've got that. We've got quite a few things to work with. And even though I find, say, hypothetically, her androgens have picked up and we get a bit of a breakout as well within, the acne tartar within the menopausal skin, we can still work with SQT. And I find I don't even need to climb into the acne set. We can still work with any of the other sets, but just work a little bit more on the breakout. So again, what I'm trying to state here is that if we do a nice little package, space it accordingly. We don't need to bring them too close together. Like even if we space them up to 4 weeks apart, sometimes if we want even up to 6 weeks apart, depending on the skin. So that's how I tend to treat most of my clients with SQT. That would be, it's easy, and I can work out in my mind how I'm going to use this product according to what I've got in front of me. So we may not start straight away, and that's actually listed in my pamphlets here. This one here, which is, premium services. I actually list this in how I'm going to work with the skin and give it to my client. Normally, I'm going to compound them some products, and then from there, we're going to go normally into SQT first, because like I said, we've got so many choices. So I hope I've answered that question.
Yeah, absolutely. And I think people these days, they jump onto trends, they have a look at, what's trending on Instagram or TikTok, and they try and think that something that someone else is doing is going to fit them. And it just doesn't work like that. Like you've got to look at environment, you've got to look at job roles and descriptions, like where are you? Where do you spend your days? What are your environmental factors that are impacting your overall skin health, not just your age and that biological clock, it's your environmental factors and how well you're actually supporting your skin with at-home care products and understanding what's going on.
Absolutely.
But yeah, I think it's definitely, the menopausal, range is difficult, but as you mentioned, we've got the 5 sets there is so many you can choose from, and that's the importance of training. Like you don't have to go in and do a usual technique that you would on a 35 to a 45-year-old or a 25-year-old. You can really change. It's all done in the fingertips of your hand, so you can change up just like you would adjust a microneedling pen. You'd adjust the needle depth to suit that skin's condition, even your technique, rather than maybe doing your cross hatching, you might do your stamping. So with SQT, it works relatively the same. We can actually get in there and do some more pressing, and really focus on the problematic areas without aggressively working it. And, I always liken the size of a spicule as a strand of hair compared to a straw. So your microneedle is your straw, and the spicule is like a strand of hair. That's the thickness comparison. So we're able to create more stimulation safely without compromising, breaking the barrier, and not having that risk of infection. And then you've got your different solutions in your different sets that help treat or reduce that inflammatory issue that the client's got going on.
That's right. That's great. And there's a few things that came to mind that when you were just talking about the actual treatment, and I've forgotten what they were. But look, yes, I find the treatment, that's what I was going to say. I may get some clients in. Like today, I had a client before this meeting that came in. She's going overseas. She had a few little things going on, around 40 years old. So I really hadn't really gotten into that, maybe be premenopausal, but we weren't addressing that. So I went to my favorite set, which is a nourishing hydrating set. I hadn't treated her before, but because she's going overseas for 6 months, I hadn't treated her face, like done a facial treatment on her. Beautiful, because it was more, she was slightly on the erythemic side. So there was probably more pressing than rubbing. So this is a good thing where we've got those choices. So we don't want to be rubbing. Therefore, we're really working those spicules right into the skin. We can press, they're still going in. They're still going to do something.
Absolutely. Thank you so much, Peggy, for sharing your
Oh,
insights
my
today.
pleasure.
Yeah,
My
and I think,
pleasure.
look, the key message here is that menopause is a natural transition,
Yeah.
but it doesn't mean that women have to simply just accept those skin changes that come
Hmm.
with it, and understanding what's happening in the skin and choosing treatments that support its natural regeneration can make all the difference.
That's exactly right.
So
Absolutely.
thank you for